research is the prevalence of long COVID, associating factors, and the holistic outcomes in COVID-19 patients, from Ms. Ramida Jangnin.
Okay. Good morning, all judges. Today I'm going to present to you the prevalence of long COVID associating factors and the holistic outcomes in COVID-19 patients. As we can see that after the recovery of the COVID-19, patients could have the residual or persistent symptom, which is defined as long COVID. So let's see what is long COVID. Long COVID is the condition that can occur in individuals with a history of probable or confirmed SARS-CoV-2 infection, usually within 3 months from the onset of COVID-19, and usually lasts for at least 2 months and cannot be explained by an alternative diagnosis. So at least one symptom of long COVID, as the time as defined here, is counted for long COVID. So let's see about the COVID-19 situation in Thailand. In this study, we collected the data during the infection during January to March 2022. So as we can see here, it's during the 5th wave, which is the Omicron variant, is dominated. It's around here. Okay, and let's see about the severe and ventilated COVID-19 cases. We can see that during this time, the severe cases is getting low comparing to the previous wave. This is correlated with the national COVID-19 vaccination coverage, as during January to March 2022, we can see that the vaccination coverage is high. And we can see that the 3rd dose, which is the booster dose, is getting high too. So the objective of this study is to investigate the prevalence of long COVID, its associated factors, the holistic outcomes in the post-vaccinated and antiviral available era in Thailand. About the materials and method, this observational study included 390 COVID-19 patients who is diagnosed during January the 1st to March 31st, 2022. These patients are from Maha Nakhon Chiang Mai Hospital, which is divided into 3 dimensions. The first one is from the home isolation. Second is community isolation. And the third one is intermediate cohort ward. These patients will be getting telephone interview. The first visit is started at 3 months after the diagnosis and will be repeated interview every 3 months through a 1-year period. So there will be total 4th visit to see about the long-term in long COVID in this patient. The questionnaire that we used included 5 aspects with using the standard scale, including into 2 big parts. The first one is demographic data, and the second one is about the long COVID information, including the first one is physical condition. The second one is mental effects. SS by PHQ-9 is for depression. GRD7 is for general anxiety. And 2P and persistent for PTSD. The next one is for sleep effects. SVSS by PSQI, TISS, FOSQ10 to see about the daytime sleepiness and also a bit the poor sleep effect. Quality of life we assess by SF12. And to see the association with the factors and long COVID, we use the analyzed by the logistic regression. For the results, in total enrollment of 390 patients, the age group is in a median age of 26 years old. And we can see that female is more than male for around 10%. In this era, as I told you before, that it is a post-vaccinated and also antiviral drug available era. So our patient in this study got vaccinated for 96.7% and 98.5% received antiviral drug during the infection. For the initial symptoms during COVID-19 infection, we got reported that cough and sore throat are the 2 most symptoms during the infection as initial symptoms, while the other symptoms are much low, especially in pneumonia that is getting lower than the last wave, like Delta variant. So the prevalence of long COVID, we see that there are 77.7% got long COVID as the prevalence. So we looked through into these patients. For 303 people, we see that the two most reported long COVID symptoms are fatigue and cough. And the other symptoms are also have, but it's lower than fatigue and cough. Mental symptoms are also reported as depression for 8.2 and also anxiety for 4.1. But this is, we excluded our depression and anxiety patient as underlying disease. Sleep quality is also reported as 33.3%, and also we have the excessive daytime sleepiness as 20%. From the logistic regression, we found that the age lower than 60 is significantly associated with long COVID, as well as having cough as initial symptom is also have the significant associated also. For the chi-square test, among long COVID patients, female is significantly associated with headache, dizziness, and brain fog syndrome. For discussion and conclusion, we can see that during this era, the prevalence of long COVID remains high, associated with the age and also the presence of cough as initial symptom. Besides of the physical condition, mental health is also affected, but lower than physical effects. Long COVID symptoms may differ upon variant, vaccination, and its initial symptoms. As we review the literature, reveal that during Delta variant, while the vaccination coverage is less than nowadays, we have the different onset and characteristic of the symptoms. So this is the preliminary analysis of the first study. The remaining 3 visits remain, and observation and causal study are still recommended to establish the causal relationship. That's all of the presentation today. Thank you so much.
So now we're moving on to question and answer session.
So how many patients dropping out from the study, and if any, so what are the reasons?
Actually, this study at the first time we do as the pilot study. Like we see during the start of the Omicron variant and the wave during after the New Year time. So we got the pilot study to assess all patients in our hand, like in the home isolation, community isolation, and intermediate cohort ward, and we call them all. And if they have the lost follow-up or unable to answer the telephone, we will cut them off. But if they can answer our telephone and can agree with the commitment to answer during whole 1 year period, we will include them into the study.
So, and what method did the patient use to complete the questionnaire? Because I saw there's several questionnaires that need to be completed.
About the method, about the collecting data, right? We have the interviewer, which is the well-trained interviewer from our professor. We have only one interviewer, so they call the patient for a 1 year period to ask them through our questionnaires that we prepare. It took around 30 minutes per time, so that the patient can answer it and not exhausted too much for the long questionnaire. Because I think that if we could do this questionnaire in the Google form, we can have the miscommunicating data, or maybe they will be in rush in doing our questionnaire. So we think the telephone interview maybe improve the accuracy in the data that we got.
Thank you.
Thank you.
We still have time for another questions. So if there are no other more questions, so thank you for your presentations.
Thank you so much.